just for background, my name is Dr. John Schnorr. I'm one of the reproductive endocrinologists here. And let's adjust this a little bit more over that way there. And as you all know, probably reproductive endocrinologists are OBGYN trained doctors who then did a fellowship in reproductive endocrinology. And I did my training at the Jones Institute, which was in Norfolk, Virginia, and I was there between 1998 and 2001. And I'm going to kind of come back to that in a second when we talk a little bit about the history of embryology. But I really wanted today to talk about the role embryologists and embryologist lab play in fertility treatment. And I have Dr. Jeff Gray with us here today. Jeff is our lab director, and he's in charge of our laboratory at Coastal Fertility Specialists, which means he's in charge of our laboratory in Charleston that does the embryology work, but he's also in charge of the andrology, which works with sperm, and with the Emulite, which does all the blood work, next to Noah Roche. And I'd like to let him introduce himself, explain a little bit about his background in training, so you understand the depth that a fertility practice needs to have like us to provide good embryology care. So,
so hello everyone. I'm Dr. Jeff Gray. I am the laboratory director here at Coastal Fertility Specialists, as Dr. Schnorr said. To give you a little insight about what that means, so I do have a doctorate in vitro fertilization research. So prior to beginning involvement in clinical embryology, I spent about 10 years doing in vitro fertilization research at the University of North Carolina, which did include my doctorate in the field. I then began my training as a clinical embryologist, which involves all hands-on techniques that go on in our laboratories. And have done that for about an additional 10 years.
Yeah.
So I've been here at Coastal Fertility Specialist as a laboratory manager and now laboratory director for about 7 years.
Yeah.
And so it's part of the, not every laboratory has an on-site laboratory director. Most laboratory directors are not hands-on laboratory directors. So I do spend at least half of my time in the laboratory doing techniques just like the rest of our embryologists. And so I think that provides unique insight into the function of the laboratory and how patient treatments are unfolding.
Yeah.
So that's part of what we do to make Coastal Fertility Specialists a special place.
Yeah, and Jeff does a great job doing that. Jeff is a very hands-on embryologist, which I've always believed is critical to managing a team, is to understand what is your team really doing, what are your team's real challenges, how can we make processes and procedures more efficient and safe, and you can only do that if you're the person with your hands on in the lab. And probably 30 to 40% of labs across the United States have an embryology lab director in-house who works for them directly. As Dr. Gray was saying, most actually are kind of subcontracted out in a way, in which, you know, the lab director is off-site and they might live 3 states away and they come and visit once a quarter and check in on things and monitor statistics. And I'm not knocking that. I'm just saying one step up on that is the ability to have an in-house laboratory director who does all that in-house, and even one step above that is a hands-on laboratory director who does ICSI on a regular basis and embryo culture on a regular basis and embryo biopsy on a regular basis and freezing on a regular basis. And you know, I've always been what I would consider a very hands-on medical director of the practice, meaning I want to know the granular details of what we do and what we don't do and why we don't do it and how we can do it better. And I don't think you can do that unless you're actively involved in that. That is a real expense to Coastal Fertility, to have extra people around on site instead of off site, and you know, clear part-time. Have them here full-time is very important to us, it's very expensive for us, but it's very important that our patients get the best care that they can. And that's one of the reasons I wanted to introduce you to Jeff Gray and let you know kind of what we're doing behind the scenes. And I've always felt that what I would like patients to know more about is generally the thing they know the least about, which is what's happening behind the scenes with that retrieved egg and what temperature settings are the incubators at and what levels of protection do we do to protect eggs and embryos. It's interesting, what I didn't tell you is I was in medical school in 1994 to 89 to 94, And at that time, I saw embryology, which was in its early in its field, and it was just growing and developing, and literally was at embryo transfers, where the eggs were retrieved at a different hospital. They were put in a tackle box like you would see for a fishing person would have. They carried the eggs over in a tackle box, went to a different hospital, and transferred the egg and sperm together into the fallopian tube of a different hospital. That was the state of embryology in 1993 and 1994. Pregnancy rates were 6 and 8% per embryo transfer. Nowadays, for perspective, at our center with a good quality embryo, it's a solid 70% chance of pregnancy. And we got a little bit fancier in our industry, and we were able to do egg retrievals with an ultrasound probe in the vagina and hand the eggs to the embryologist. The embryo labs that were really good could keep an egg and embryo alive for about a day, and then you had to transfer them back into the fallopian tube the next day via laparoscopy. And then we got a little bit better, and something called a blastocyst came along, which was an embryo that grew for 5 days, and we knew how to grow them in the lab for 5 days. And it was probably 2001, 2002, 2003 that David Gardner started talking about growing them in extended culture and doing some unique things there. And when you really step back and look at leading centers across the United States in 2024, those leading centers have a very good team of doctors who also work with a really great team of embryologists. And Jeff is part of that team that's helped bring us to a different level. If you look at the national pregnancy rates from SART, you'll be able to see what our pregnancy rate is compared to the national average, and other centers are on there also. And I'd like Jeff to talk a little bit about what he looks at behind the scenes for quality assessment, quality control, and what things we might be doing along the way to try to get us into that top tier of embryology.
So in terms of fine-tuning things in the embryology laboratory, that consists of not only having the highest quality state-of-the-art equipment, but fine-tuning the management of that equipment to be the best it could possibly be. We have tracking systems that watch implantation of embryos and development of embryos in the incubator that have led us to understand that we need to change the filters in the incubators more often to improve the quality and the environment in there. We have consulted with leading air quality experts in the field to get the best quality air handler filters possible to create optimal environment in the laboratory. We also, being hands-on in the laboratory allows me to fine-tune the function of the incubators to allow any drift in their function to be corrected immediately. So all these things contribute to not only very high level of results, but very consistent results throughout the year, which I think gives every patient the best possible chance of conceiving with their treatment on any given day.
Yeah. And so, you and I live in rooms and stuff that might exchange air 3 to 4 times per hour. But in the embryology lab, we have operating OR level HVAC systems that exchange the air at higher frequencies. We have filters, which are particulate filters called HEPA filters, which block all particulates you may be coming in. But we also have a charcoal filter, which is very unique and different, which takes out VOCs, which are the smells of perfumes and colognes and fresh cut grass and the exhaust from a car out front, and it takes all that stuff out of the air. And that becomes very important. And we have UV lights that are actually in the HVAC system to help with any biologic kind of insults. And so these are all levels of protection so that we're protecting the air that the embryos are seeing. We have these protections built into our body, but the embryo doesn't have those protections built in. So we need to protect them. We also use something which is fairly unique for the industry, is something called an isolette. Can you explain to them what isolettes are and why we take that extra level of care for the embryos?
Right, so not only do we, every laboratory has incubators. We have state-of-the-art incubators, but we do take it to another level where all of the handling of the embryos while they're in culture, all the handling of the oocytes while they're being retrieved, or the embryo while it's being transferred, is done in a specialized handling incubator called an isolette. These entered the field as modified NICU units, and so premature infants would go into these, and so where they could have the gaseous environment and temperature controlled to protect a premature infant. IVF took these and modified them to optimize the handling of a dish, of a culture media dish. So even while we are handling embryos to assess fertilization or change media or select blastocysts for utilization, all of that is in a very controlled, protected environment. So even the most brief exposures from when taken out of the incubator are done in a handling incubator. So just to provide the completely optimal environment for eggs and embryos while treatment is ongoing in the laboratory.
Yeah, so, and that's important, and we meet once a quarter with Dr. Gray and the entire laboratory team, and we go over pregnancy rates, fertilization rates, blastocyst development rates, all metrics that we use to analyze the performance of a lab to make sure that there hasn't been any drift or shift in protocol or anything that might harm patient outcome. And so we are very attuned to all those little things. When I was a fellow at the Jones Institute, again, I trained with Howard and Georgiana Jones, and Dr. Howard Jones was just a brilliant thinker and always on top of things. And he at one time came to me, he said, John, and I was in front of the whole, group. He said, John, what do you think if you could ask only one question of every embryology lab in the United States? What one question, John, would you ask them to figure out their quality? And that's actually a challenging kind of question. So we're thinking about, I'm thinking pregnancy rate, I'm thinking implantation rate, which is the pregnancy per embryo transfer. I'm thinking about a variety of different things. And so I said implantation rate, which is the pregnancy rate of every embryo put into the uterus. And he said, no, that's not it. And I said, Dr. Howard, what is it? He goes, the number of embryos they transfer. That the best fertility practices transfer a lower number of embryos. Now, nowadays, we all believe that in our industry, but we didn't all believe that in 2000 and 2001 when he asked that question. That's how foresight, he had so much foresight and knowledge that he knew that's what it was, right? And so it makes total sense, right? If you got a bad lab that's not doing a good job, you transfer more embryos to compensate for the pregnancy rate. If you got a good lab, you don't have to transfer more embryos. You can do a lower number of embryos. So with that said, Dr. Gray, let us know what % of our cycles are one embryo transfers and what % of our pregnancies are twins.
So over 90% of our embryo transfers are single embryo transfers.
Yeah.
And for less than 1% of our pregnancies are multiple pregnancies.
Right. And so if I'm the patient, I would say, Dr. Schnorr, I've been trying to get pregnant now for 5 years. I'll be fine with twins. As a matter of fact, I want twins, Dr. Schnorr. I hear that all the time. And then our reply is pretty simple. Twins are associated with a 7 times higher chance of autism and a 7 times higher chance of cerebral palsy. So I'm going to increase your risk of having a baby with a birth defect by getting you into a twin pregnancy, God forbid a triplet pregnancy. Therefore, the best centers are going to do one embryo transfers to give you the best chance of pregnancy and the best chance of a healthy pregnancy. And so what Dr. Gray is saying is less than 10% of our transfers are 2 embryo transfers, and the chance of multiples is in the 1 to 2% range, which is incredibly important to us who cares not only about getting you pregnant, but you having a safe pregnancy. And so that's generally 1 embryo at a time. Now, there are cases and situations where a 2 embryo transfer makes sense. That might be somebody who's got a very low number of eggs and embryos, somebody who's got low embryo quality. There can be reasons for that, and I'm not saying that everybody should be a 1 embryo transfer. But I think the manifestation of your doctor's decision-making in regards to how many embryos to transfer is in what the multiple pregnancy rate and overall pregnancy rate is. So you can see we have a very good overall pregnancy rate per transfer that's in the 70% range per new patient visit, I think was our most recent statistics. I think it was 72%. and our multiple pregnancy rate in the 1 to 2% range, meaning we're doing everything we can to keep that rate low while at the same time maximize the overall pregnancy rate. And part of that is a very good culture system so that you have confidence in the embryos you do grow out. So going back to Dr. Jones's original question, that's how you determine what a good lab is. So Dr. Jones unfortunately passed away several years ago, but I think about him frequently. He taught me a lot and I think made the world better, particularly with embryology, with all the things that he's done. I want to stop there to see, do we have any questions to go over? No big questions.
Not yet.
Okay. Well, what I'd like to do is just kind of pause here for a second and see if Dr. Gray has any final thoughts about World Embryology Day, kind of how the field's developed. And Jeff, what do you think the field has in front of us? What do you think we might see over the next 5 to 10 years?
So I think taking a moment on World Embryologist Day to kind of celebrate the role of the embryologist, I think is a very important thing to do. And in my mind, it's very important to distinguish an embryologist from a laboratory technician.
Yep.
An embryologist is someone with that not only can do the things technically in the lab that we need to do, but has an understanding of how eggs and embryos and techniques in the lab develop. So it's not only a technical understanding, but a feel and a knowledge. And so that's gained by experience and teaching of quality individuals. So, the quality of the embryologist in a center is exceptionally important. Someone going through the motions and doing the techniques in a technically correct way is not going to give you the same level of outcomes or same level of insight into treatment. So, we're very fortunate here to have an exceptional team of embryologists who are truly embryologists, who have an understanding of how embryos develop and behave in pre-implantation development. And that gives us a unique opportunity to work exceptionally closely with patients' physicians in taking what we see and observe in the embryology laboratory to tailor their treatment. And I think that's a big part of our success is individualized treatment. And having our physicians have it, being accepting of the information given by the embryologists to tailor treatment to what we think is best for patients.
And I think Jeff brings out a good point. I mean, something we do a little unique and we're notorious for is that if somebody has a very low number of eggs and a very low number of embryos, sometimes we feel that their incubator, meaning their uterus, is better than anybody else's mechanical incubator inside the lab. And so if we only have 1 or 2 embryos, why would we grow them out in an artificial environment and do a 1 or 2 embryo transfer in 5 days? Why wouldn't we just put the embryo back in the uterus a little bit earlier at a time which maybe they'll get a little bit more nutrients from mom and from the uterus and better pregnancy rates? And in fact, in that challenged group of patients, which is a very low number of eggs and embryos, we fairly consistently get a 25 to 30% chance of pregnancy, which if we did extended culture and an embryo transfer, often the pregnancy rate would be much lower than that. So, that's one case where individualizing patient care makes us better. And so I don't think that we do one thing right that gives us the pregnancy rates we do have. I think we do a lot of things right, meaning that we're not missing things along the way, and we're spending a lot of time customizing the protocol for the patient in front of us. In regards to what's the embryology world going to look like in the future, I would have to say that right now we use a laser going through a microscope, taking cells away from an embryo to genetically test that embryo. I can see a world in which maybe instead of having to do that, we can measure how much CO2 the embryo uses, how much oxygen the embryo uses, kind of the metabolism of the embryo, just like we can understand a human's metabolism by drawing their blood and measuring their oxygen levels and other metrics in our blood. I think in the embryo culture media, we're going to be able to see the respiratory rate, if you will, of the embryo to know the health of the embryo. We might even be able to detect DNA that's in the media that came from the embryo itself to know the DNA status of the embryo in a non-invasive way, so you don't need to make an incision to do it. There may be a role for artificial intelligence with image analysis, seeing the embryo and counting the number of cells and looking at the structure, and with that predicting which the best embryo is. I'm very bullish on technology and the future of reproductive endocrinology, probably because I came from a world in which the pregnancy rates were 7 or 8% every time we put one embryo in. And at that time, frankly, we were putting in 4 embryos, right? And you can imagine what 4 embryos can do if any of them were good. And now we're to the world where it's 70% with a 1 embryo transfer. So it'll be interesting to see how things change in the future. I think maybe there's a future where we don't give injectable medications to women to make eggs at all. Right now we do 12 days worth of medications and mature the eggs. I see a world in which we biopsy the ovary, we take immature eggs out of the ovary, we hand them to great people like Dr. Gray, who then take these immature eggs and make great eggs and make great embryos, and we always put them in one at a time, and voila, we got a nice pregnancy with maybe a 90% chance of pregnancy rate. We'll see. So I'm going to pause there. Any questions to go over?
No, but we had a comment.
We got some comments.
Yes.
Hopefully they were good comments.
Yes, it's a great comment.
Okay,
Brandy said, our family sure is thankful for Dr. Schnorr, Dr. Gray, and all of the amazing people at CFS that have given us one amazing 3-year-old little boy and a baby sister that is currently halfway finished baking.
Wonderful. Well, we are great to see that, and I love what I do, and I've been doing this for over 25 years now, and the part that I love is helping couples with challenges who are stressed when they come in, and they're afraid they're never going to have a family or not to have a genetic family, and to see them come back in 2 or 3 years later with a baby on their hip, a little bit disheveled, a little bit tired because they're not sleeping well at night, with Cheerios falling out of their pockets, to see the full family and see the journey move out. And we're not perfect, and we do make mistakes, but we do our best to prevent mistakes and help people through them if that does happen. But overall, our success rate with persistence is well above 90%. So we want people to come in with confidence to know that we get a great team that can help them through it. So with that, I'll sign off. It's great spending time with everybody, and I hope you guys have a wonderful rest of your week and weekend. Take care. Bye-bye.